Welcome to Healthy Lifestyle with Lorianne. Guess what? I'm Lorianne. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. I hope that made you smile. I kind of laughed here. Today, we have wonderful guests. We're going to kind of hit a very hot topic that is all in all of our lives in maybe a lighter fashion, give you some tools to look forward to. So today, we have Dr. Barbara Keber on, and she is board certified practicing family medicine, and she's a family physician for 35 years working for Northwell Health Physician Partners in family medicine at Glen, Cove Hospital. She serves as a chair at family medicine at Glen, Cove, and the vice chair of the Department of Family Medicine for Northwell Health. As a leader in family medicine, she has been instrumental in developing the patient-centered team-based approach, especially in the area of diabetes management. Dr. Keber is the physician leader for the diabetes program in both the inpatient and ambulatory settings. Her passion for working with the underserved population and those with diabetes has enabled the development of a team-based approach with improved care for these patients. Welcome to the show, Dr. Keber.
Thank you very much for having me.
It's a pleasure, absolute pleasure. So you're very family-based, family medicine-based, and so let's just start right off the bat defining what's family medicine.
Yeah, so a lot of people aren't really aware of what family medicine, what we actually do in family medicine. And it's one of the specialties. It is a specialty. We have a 3-year residency program that we do, just like people that do internal medicine or pediatrics or other different specialties. And so we are a truly a specialty. In which we care really for the entire family, and it's really, some people like to say cradle to grave. I had a nurse that worked for me for many years who used to say the womb to the tomb, and really that's true because we take care of babies before they're born, and I did deliveries for 17 years, in delivering babies and taking care of moms, prenatal, giving prenatal care. And we take care of patients all the way through childhood, adolescence, adulthood, and through the geriatric years up until the time that they die. And providing really good care to patients at all ages, both in the ambulatory setting and the hospital setting. Some of us work just in hospitals. Some of us work just in the outpatient setting. But we really are equipped to really do pretty much anything, which, in the current situation has really been sort of a help to the system, because we can really kind of do whatever is needed.
I look at family practitioners mostly like the general contractor for medicine, because am I right with that? That you oversee basically everything that's happening. So isn't that what differentiates you from specialties?
Absolutely, and I think that the biggest thing is that family physicians have their patient base, and those patients look to us regardless of whether I send a patient to a cardiologist for a problem that's beyond my scope. For instance, they need to have a catheterization to see if they need a stent or something along those lines. And it's pretty interesting because most of my patients won't do anything that the specialists tell them until they check it out first with me. And that's true for a lot of family docs. I'm actually the president of the New York State Academy of Family Physicians this year, and so I talk to doctors all around the state and all around the country who are family docs, and many of us have that same interaction with our patients, and our patients really trust us, and we really are helpful in coordinating things when there are multiple specialists that are required to care for a very complicated patient, especially in the hospital setting.
Yeah. Well, how do you differ? How does family doctors differ from an internist, or is there a difference?
Well, I say there is. Family medicine always really looked at the actual patient in terms of all of the psychosocial needs. It's very interesting that, we talk now about social determinants of health, and we know that 80% of a person's health is related to their ability to get proper food, proper exercise, work in a safe environment, etc., to be able to pay for their medicines, to have transportation and access to physicians and medical care. And we know that, only 20% of what we do in the office is actually contributes to their health. And it's very interesting because the psychosocial part of that, not having transportation, not having access, not having a good food source on a regular basis, those things create a very, very difficult scenario for people. And we've always looked at that in family medicine from way before this was kind of like the hot topic to be involved in taking care of social determinants of health. And we've worked in community medicine and working with different populations, and in particular, some of our populations here in Glen, Cove. We've been able to work with that population who are underserved and really try to bring them into our family medicine center and give them the care that they deserve and that they need, and really to help them. We have social workers and behavioral health workers and other individuals who can work with the physicians. That's what I say when I say team-based. So I have a diabetes educator who's a nurse practitioner who works very closely with us for those patients. Social workers, we have 3 of those.
Sure.
Work on other issues, for instance, patients that can't afford medications. We work to get them medications at a cheaper rate, and we do what we can to assist them with that. So I think, we're different. It's interesting because the patient-centered medical home, which is a really a way of taking care of patients in primary care, it started in pediatrics, but family medicine has always been about doing that and taking care of the entire patient and the entire family.
Yeah, so
knowing the whole family really makes a difference as well, because we can really be involved in the care of the entire family.
Yeah, and you're looking at the holistic. You're looking at the whole person holistically. Absolutely. From the beginning to all the way through their transitioning. And the thing about that is, doesn't it help you better care for the children when you already know the family history and more intimate things, intricate things that help you with the decision-making process. So when those reports come back from the specialist, you can really sit down and have a plan for what's going on.
And I think that's crucial to really, and that's even more crucial now that we do have a lot of scenarios where doctors are taking care of patients in the hospital that are not their regular doctor. And, having us be able to be involved, even if it's just with a conversation with the specialist or the hospitalists that are taking care of them when they're very ill, if we don't go in ourselves. Many of us actually either still take care of our patients in the hospital, as I do, or in other situations, at least we are communicating with those physicians that are caring for them while they're in the hospital. And more ill, and then transitioning them back to the outpatient setting. That's very crucial. Those times are the times when things get lost in the shuffle, and making sure that you really know the patient. Yeah. Is what we're able to bring to the table, and really having those relationships with the patients and with our colleagues, with our specialist colleagues, or the social workers, or the rest of our team. People ask me often, what one word just can describe family medicine. I usually use the word relationships, and that's really the thing. It's relationships with our patients, with their families, with our colleagues, with our nurse colleagues, with our nurse practitioners, our diabetes educators, the entire team that we can wrap around the patient, really to provide, excellent care for them as best we can.
Yeah, and I suspect, because I know when doctors ask me questions, I always forget. They go, are you feeling good? Yeah, I'm feeling fine, except for whatever is ailing me at that moment. And they'll ask you different questions, and I don't remember it. But you, as a family physician, you'd have that background and say, wait a minute, what about this? This is what may be contributing, because we forget, because, we just keep moving forward. At least I know I do. I'm a terrible patient.
For most people, Lori, and I think most individuals tend to neglect to give all the information. That's one thing that the electronic health record has kind of helped us with. That having access to the chart for the specialists that see our patients, and actually having the record from the family physician right there in front of them. So even if the patient forgets to tell them some medicine that they're taking or whatever, at least we have a record of it in the chart. So the electronic record has been helpful in that way, although it certainly has its ups and its downs.
Yeah, and you actually can be an advocate because you really know the history and you know these people. You're a trusted source for us as a family-based physician, and also can't you provide baselines? So you already know they may have had a heart situation in the past, or they may have diabetes, or they may have a propensity towards diabetes, et cetera. All different versions of that. So to me, having a trusted source and some one point person who acts as that general contractor for medicine is sitting there and being that advocate for the entire family. I know that provides a lot of calm for me because I don't know these doctors. I'm sure they're fantastic at the emergency rooms and things like that, but they're not there for the purposes of get to know you. They're there to get you as best suited and stable so then you can progress through the system, right?
That's correct. And that's the biggest difference, I think, between what we do and what some of the specialists do.
So if you were to list the top 5 reasons to have a family doctor, what would they be? I know we covered some of them, but how would you explain this to someone?
So I think that the very first reason is to have that trusted source, as you described, and to have that person that you trust with really a discussion of anything that you're having an issue with, whether it's a psychological issue, whether it's I've had a number of conversations with patients over the last few weeks because people are very, very anxious over what's going on with COVID-19. And I've had many conversations, as long as a half an hour on the phone or telemedicine, with patients about their anxieties over this whole thing, or those people who've been diagnosed and talking them through it. So I think having that trusted person, that go-to person, and certainly in times like these, is probably the top reason to have that person. The other thing is just, again, as you mentioned, knowing the whole family, I think really can sort of put together things like you have an insight that's somewhat different than that specialist who really doesn't know the rest of your family. You know things that are tendencies within a family, genetically or medically, otherwise, things, and that's a really important piece of what we do by caring for. I have 2 families that I've cared for 5 different generations in the family at this point in my career, and many that I've cared for 3 or 4 generations. Wow. And that's a really very, very helpful piece to the puzzle when you're taking care of one member of the family and things about their parents or their grandparents that they may not even be aware of. And so that's the second reason. I think another thing is that, being that holistic kind of person that family medicine is, and knowing the whole of everything about a patient really also helps us to sort of direct them. So you may know a person is going to be not likely to go for a colonoscopy. And that's something that's really important in terms of colon cancer prevention. So there are other ways to test for that. And so if you know someone's not going to do that test because you know how they are, you know them well, offering some other alternatives to that test by offering something called a FIT test, which is a test that we check the stool for blood by an immunological test. To be able to offer that to somebody who you know isn't going to do the other procedure, while it's not quite as good as a colonoscopy, it's better than not doing anything. And so also, when I choose to refer people to specialists, knowing the specialist and knowing the patient, I try to match them.
Gosh, what is it like?
So that I'm able to get somebody who they're going to be able to be comfortable with.
Right. I understand. What is it like for you to care for multiple generations? Right? I mean, that must be amazing.
It's really incredible. I have a number of. It's pretty interesting. I was rounding in the hospital with our COVID team that we call right now. And one of the evening nurse managers, who I don't really see very regularly because I'm not usually up there, is actually married to someone that I delivered.
Oh, my goodness.
And took care of many times in the hospital as a young child, many years ago, with a history of asthma. And so, she said, oh, my husband said, say hello, and, that type of thing. And they now have kids, and I took care of his mother and his grandmother. So, it's one of those things. It really definitely, people talk about burnout and lack of resilience in the medical profession. Yeah. And I think that, honestly, being able to take care of multiple generations and have it's very rewarding, and having that continuity, I think, helps us keep our resilience. The one-offs are really not so rewarding because you see them and you never know what happens to them after that.
Right. Yeah. It's like a good story. You want to know how it ends.
Yes, exactly.
So do you buy into concierge medicine, which is the new, a newer form of family medicine where they actually go back to when I was growing up, where my physician used to come to my house?
So guess what? Some of us still do go to the house. I go to the house still for some of my patients.
Okay, now you're just a superhero.
Yeah. So, it's definitely a different era. I don't do as many of them based on all my administrative responsibilities currently. But certainly we actually, that's part of our training in family medicine, is to perform house calls. And how do you do a house call, and what are you looking for when you go to the home? And, what can you find out, which is another whole series of things that you can learn about a patient by visiting them in their setting. So I very much buy into that model. I think the model of having a base of patient care, a group of patients that you care for and that you care for on a regular basis, is really what family medicine is all about.
Yeah.
I think that, I think the place where some of the concierge models run into difficulty from my perspective is that kind of limits the number of patients that a given physician will care for. And that's got its advantages and its disadvantages. The advantage is that everybody that's being cared for by that doctor is clearly getting excellent care, but it may limit the access for other people, particularly those who are not able to pay those concierge fees. And so that's where I run into my difficulty. And we in family medicine really are on the front line in terms of taking care of the underserved in this country, both rurally and in urban areas and suburban areas. If you look to see who's taking care of the underserved community, it's mostly family physicians.
Yeah, understood. Yeah. So in the last couple of minutes that we have, really briefly, how does Glen Cove Hospital serve the community?
So actually, our service to the community is really vast. We have a full scope general community hospital here for all the patients in the community. We're clearly serving it quite well right now during this outbreak of the COVID-19 illness. We've been able to really care for everybody that's presented. We've been able to, as our domain in the ambulatory setting, to try to keep our patients who either are less ill or are ill with other issues by continuing care either telephonically or by telemedicine, telehealth. Try to keep those patients who are less ill out of our emergency rooms and our urgent care centers, where we need to be able to take care of those who are sickest, who might need admission to the hospital. And Glen Cove has been able to admit all the patients that have presented to our emergency room. We've been able to take care of them using ventilators. We have had enough ventilators. We've had, been able to provide really all the needed ICU care. Some of the medications that are being tested for treatment of COVID-19 are being utilized here. We're in contact. That's the advantage of being part of Northwell, is to be able to utilize, some of the research protocols and whatnot. So we've been able to do really everything that's been necessary. And on a routine basis, not during a COVID pandemic, we provide really basically all the basic needs for anybody in the community. What we don't do is provide tertiary care, and so we don't do cardiac catheterizations, and we don't do heart surgery or heart transplants. Those things, because we are part of Northwell, we have very good connection, And again, information goes back and forth between the different facilities and the different physicians caring for the patient. So those particular needs that are extraordinary are reserved for the tertiary centers, which is the way it should be, because you could never have a cardiac catheterization center in every single hospital.
Absolutely.
In the country. It's not appropriate.
Absolutely. Dr. Keber, thank you so much for being on. This information has been invaluable to our listeners. If you don't have a family doctor, you really need to look at that for now and for the future, so that you have a go-to source who knows everything about your medical history and helps advocate and helps you go through a process that's new and interesting. You are listening to Long Island News Radio. We are Healthy Lifestyle with Lorianne, and we will be back in just a few. Welcome back to Healthy Lifestyle. I'm Lorianne. If you have any questions, comments, or ideas you'd like to hear more about, please email us at healthylifestylewithla@gmail.com. And also follow us on social media at Healthy Lifestyle with LA. We love hearing from you, and we answer every email and post personally, and really, really appreciate the interaction and the questions that you send us during and after shows. And we will be live streaming. We believe we pushed it back because of circumstances back to May, but we will be. So keep looking for us that way. To continue our conversation, and we're here with Northwell Health today. We're very blessed to have an association with them. They're wonderful services out there. We are going to speak to an ER doctor right on the front lines to give you the best information possible, so you feel informed, and the information is coming right from the doctor who's actually in the ER. So Dr. Payal Sud is an associate chairperson for emergency medicine at Glen, Cove Hospital, a part of the Northwell Health System. Her focus includes operations and quality improvement. Previously, she has served as the associate program director for the emergency medicine residency program at LIJ, where she helped create the new Hofstra-Northwell EM residency at Zucker School of Medicine. Additionally, Dr. Sud is a practicing medical toxicologist, intimately involved in the Medical Toxicology Fellowship. She has published and presented in several medical journals, textbooks, and at national conferences. So she really comes with quite the background. Her focus now is ensuring that the public, patients, and healthcare workers are well informed and safe from COVID-19. Doctor, welcome to the show, and thank you so much for taking some time off of the front lines, and thank you so much for everything you're doing every single day for all of us here on Long Island.
Thank you for having me.
It's a pleasure. So let's talk about the virus. Let's drop it down to basics. Basics. How is the virus transmitted as we understand it today? Because this information obviously is constantly growing and moving, right?
Correct. I mean, that's the biggest thing I think we all have to realize is that we might feel that, one day we hear one thing, the next day we hear something else. And that's really because this is a very new virus that we're all faced with, that was only found a few months ago. And the information that's out there, all the medical information and any kind of discoveries that are out there are all rapidly changing. So back to your question about how is this spread, the easiest way to spread this virus is through respiratory droplets from person to person. So if somebody coughs or sneezes, or maybe say coughs into their hand and then extends their hand out to you to shake your hand, that's an easy way of acquiring the virus. And this is why right now the social distancing of 6 to 10 feet that we're hearing over the recommendations is really important, because that's how far an infected person's respiratory droplets would travel.
So if they sneeze, it could go that far.
Exactly. Wow. Sneezing, coughing.
It's just incredible to me how swiftly the medical field is moving on this. Scientists and doctors are all getting together, jumping on this worldwide. And we're all, doesn't matter where we are in the world, we're all dealing dealing with the same issues. So we're all dealing with worrying about our safety, our families, our friends, economics. It doesn't matter what our background is. It doesn't matter what our nationality is. It doesn't matter what our religious base is. We're all dealing with this at the same time. And the medical community just steps up time after time. I'm just totally impressed with that. Doesn't that amaze you, even being part of that process as well?
Oh, absolutely. I must say, being on the front line, being in the emergency department, I have been so touched to see how many people in the medical community have fearlessly stepped forward. And these are all people, who have families and loved ones and vulnerable populations of their own at home. But the moment the news of this virus kind of hit, the moment we started seeing patients flooding our emergency departments sick from this virus, the entire medical community has stepped up, volunteered to work extra shifts, put in extra hours just to keep the community safe.
Fierce.
And I think it's amazing.
It is amazing. They're fierce and fearlessly. To me, they're the real heroes. You guys are the real heroes out there because you're going there, like you said, knowing you have families and friends that are at home. You're still running towards the issue, towards the virus to see how you can counter it and help other people. So, and that's what we're here for. We talk about that on Healthy Lifestyle all the time. We're here for two reasons on this earth. One is to learn, and the other is to serve other people. And you do that day in, day out, fearlessly. It's so important and so appreciated. I hope you feel appreciated because we really, us non-medical people, are really appreciative of what you do and can do.
Oh, thank you. We're definitely feeling the love. I mean, I can say, especially at Glen Cove Hospital and at a lot of the other hospitals as well, the community has really stepped forward to show their love. I mean, every day we're blessed to get a lunch and dinner and breakfast donations from local restaurants and friends and family who are sending over food, which, when you're working long hours in the emergency department, a lot of times there just isn't time to go get some lunch or to pack some lunch when you get home after a long shift.
Sure.
So just to have that kind of outpouring of love from the community means a lot to us and keeps us going.
Yeah, I can totally understand how that does keep you going. And these are the signs to me that I like to look at because, I'm always that rainbows and unicorn girl so I look at things like that and I'm watching the best come out of people helping each other. And this is such, to me, it's an opportunity for us to learn. It's a hard learning curve that we have here, but it's an opportunity to see how we can put our better selves forward and implement that on a daily basis. And we're watching that day after day, week after week, and especially with heroes like yourself. And one of the things that crosses my mind because I'm hopeful and hearing wonderful stories about how the numbers are going in a different direction. They're on the other side of that mountain climb. But I get concerned about people getting complacent because we're trying to keep it controlled and contained. So what are your best recommendations as far as that goes? I mean, does that concern you, complacency?
Absolutely. That is a big concern for me. I'm cautiously optimistic about where we stand right now. Some people have said we might be at the peak because the number of patients coming in and needing hospitalization is not as much as it was in the preceding weeks. However, going back to what we said about how easily the virus has spread, I'm very cautious to even make that statement because things could tip the other way very quickly because of complacency.
Right.
If people feel that, maybe now the worst is over, which means I can go out and about and go about my regular daily activities, it's very easily things could go back the other way and we could see another rebound. So because now we might be at that peak, we really have to continue our social distancing efforts more than ever and really continue this to try to control the spread and prevent a rebound, because a rebound would be a terrible thing.
Right. And you want to ensure that you're not increasing the exposure. So wearing the masks and gloves in public is still safety measures that you really should take and not take it lightly. I have another question for you, Doctor, and you may or may not know the answer to this, but it's just been really bothering me. So the number of cases obviously increased dramatically when the testing became possible and people started getting tested. Yes. Now, I know I had some kind of a flu back in February, but to me, I just likened it it to just a regular flu that was coming around. And I didn't get tested, and I didn't leave my house. I just was not happy for a couple of days. And I think it was about 3 days. I had a fever, but it wasn't a high piked fever. But so, I mean, how many of these numbers do you think are from people like myself who normally wouldn't go out and get those kind of tests, normally would be home and wouldn't be on these averaging numbers that we've seen previous years? Do you think there's a big spike in this because of the testing capabilities? And I don't mean that in a negative way.
I mean, absolutely. The number of cases is going to increase when you have a large denominator. So the more people you test, the more positives you're going to find. That being said, we definitely have seen a disproportionately large number of people getting hospitalized with this as well. So it's definitely twofold. It's the number of tests that have increased that's leading to more people, but also because the virus is spreading. So I think it's a twofold answer to that.
What about, just to shift into a different direction, what about grocery shopping and going out and doing those things that we have to do so that we can stay in our homes and stay contained? How do we approach that? Because, some people are just losing their minds about touching anything that somebody else might have touched. And I was in a grocery store recently where I was, a good 10 feet away from the woman, and she just stopped dead in her tracks. And I was just like, I stopped too, because I didn't know what she wanted me to do. Right. So I ultimately ended up turning around and going down another aisle because I didn't know what to do. I didn't want to make her feel uncomfortable. I felt completely comfortable because I had my mask on, I had my gloves on, and I was, being cautionary. But when I take those groceries home, I do kind of wipe them down with wipes and things like that before I bring them into my house. Are those kind of things overreactive, or are those things that would be good to do?
So those are some very good questions over there. So just taking it back to the beginning, when you're going grocery shopping, I think the biggest thing that we should remember to do is wear a mask. Right now, everybody should wear a mask. Gloves, some people have been wearing gloves, although, I don't know if that's really the best idea or not, because I think wearing gloves and going out grocery shopping can give you this false sense of security that you're protected.
Right.
And most of the people, when they're wearing gloves outside, they're wearing these gloves, and with the same gloves, they're touching their cell phones, transferring whatever germs get onto their gloves onto their cell phone. Then they pick up the phone and put it to the ear. Now those germs went onto their cheek.
Right.
It's almost easier and better, actually, to not wear gloves, but instead wipe down the cart with a wipe, keep a hand sanitizer with you, and it's much easier to disinfect your hands with hand sanitizer than disinfect gloves.
Oh my gosh, I've washed my hands and I have hand sanitizer everywhere. And it's just, I've never washed my hands so many times. It's just like, I feel like a doctor, like I'm scrubbed up to the elbows all the time.
And then the other thing is safe disposal of gloves. A lot of times, unfortunately, we're seeing outside grocery stores and just outdoors, people are discarding gloves after they use them and they're out on the floor. And these are contaminated items.
Yeah.
If you're wearing gloves, we have to make sure that they're discarded properly in trash cans and not left lying around. And then going into the grocery store, like you mentioned, keeping the safe distance. And a lot of grocery stores have been great about this. They limit the number of people that can go in at a time. They maintain the 6 to 10 feet distance. They have special hours for the elderly and the immunocompromised.
Yeah, I love that. Stop and shop. God bless them. That was a really brilliant idea.
And then the other thing I think to remember is, it's common courtesy, but the grocery store, the people that work over there that are stocking these shelves, they're essential workers that are putting their lives at risk also, making sure that we get the essentials that we need. So if you go into a store and you see that they're out of some items, please don't get angry at the grocery store.
Be nice.
Please be nice to them. They're working so hard to make sure that our families are fed. So
and that's a very valid point, very, very valid point. So what do you do to keep your family safe other than, obviously the masks?
The mask is really the big thing, and keeping that social distancing. So for myself, when I go home after working in the hospital, I have a whole decontamination process in place, and I know a lot of our healthcare workers have similar processes where our hospitals are providing us with special scrubs and whatnot. So when we go home, we don't take those same germs home. But even then, we're removing our clothes, we're decontaminating away from where the rest of our family is, showering, washing everything before we go out and be with our family. But even being with our families, we're trying to maintain a safe distance. Now, easier said than done. I have an 8-year-old and a 7-year-old, so, it's definitely hard to try to maintain that distance, but we have to do the best we can.
Yes. Wow, God bless.
As you mentioned with the groceries, when we bring them home, decontaminating them, that's a good idea, but one thing to remember with that is, again, the virus is mostly spread through these droplets and, between humans, and although it can survive for 24 to 72 hours on different surfaces, that transmission is not nearly as much as it is between people. And so if you are decontaminating certain produce and whatnot, just be careful of what wipes you're using, because remember, not all wipes have chemicals that are okay to ingest.
Yeah, exactly. So out of everything, what has been, or has there been anything about COVID-19 that surprised you?
In a good way or bad?
Anyway, anything that has surprised you about COVID-19? Because this is not your first rodeo. You've experienced flus and what was it, H1N1, and then swine flu. So this is not our first rodeo on it. It's just one because of 24/7 news and because of social media. We're a lot more connected than we used to be.
Right. That's so true. And I say this all the time. This is the first kind of pandemic spread that we've seen in the era of social media, where everyone suddenly has access to information and misinformation,
right,
and is able to spread it. So I don't know what's spreading faster, the way information is spreading or the virus itself. It's hard to say. But a couple of things have surprised me, some good and some bad. The thing that surprised me about COVID-19 is how many different presentations we're seeing in people that are coming in with this virus. It's not just a simple respiratory illness in all, like we see with the flu, or like we saw with SARS and MERS.
Right.
People are coming in with multiple different complaints as well. But in terms of something good that I'm seeing with this is I haven't seen this much solidarity before across the world as I'm seeing with this.
Yeah.
All the healthcare workers coming together, communities coming together. I know it's a terrible time, but honestly, once we're past this, I think we'll really see what an amazing thing this has done in bringing people closer together by keeping them further apart.
Yes. And people are missing being close together.
Yes.
It's just,
absolutely.
And they're finding very inventive ways of doing that. They're having like Zoom gatherings and things like that. And I love your observation. I've had the same observation as well. And I think, again, it's an opportunity for us to look at the world a different way, that we aren't so different. We all experience the same things in the end. It's how we get there sometimes. Our travel there, our journey there is different, but we're all worried about the same things and we're all missing each other.
No matter where you are in what part of the world, no matter what socioeconomic group you belong to, no matter what your profession is, we're all going through this together.
Agreed. If you were to tell our listeners, which you can right now, something that would be most important that you wanted to share with them, what would that be?
I think the biggest thing about what I could share right now is just not being complacent about the positive news that we're hearing, in the sense that let's continue this effort further until we can really drop those numbers before we go out and about without our masks and before we go out and, can disregard social distancing. So hang in there, we're almost there. So let's just continue our efforts a little bit more. And secondly, you mentioned earlier about the medical community working towards different possible cures, and there's lots of clinical trials out there about various medications that may help patients who have COVID-19. Unfortunately, right now, there hasn't been any proven cure, although there's lots of different medications out there that have been touted to help. But the clinical trials are underway, so, hold your breath. Hopefully, we will have some answers soon. And simultaneously, there's trials out there to develop a vaccine for COVID-19. And so when this vaccine does become available and widely available to everyone, I strongly encourage people to go ahead and get the vaccine as recommended by their healthcare provider, because we see kind of the effect now, the terrible effect of what can happen with just one disease when we don't have one vaccine. And we realize how important it is to get the proper vaccinations on time to avoid future pandemics like this.
Yeah, it's just, I still can't get over the fact how quickly, if you really look at the dates, when it really started getting very, very apparent that this was spiraling was at the end of January, and we're in the middle of April, and we're already in testing. That to me is just amazing what the scientific and medical community is doing right now. And I don't want to look away from that, because that's, to me, they're saving lives. You're saving lives every single day. And that saving of lives is a lot higher than our loss of life. And I really want to look at those numbers and remind people of that by actions like this, by people coming together across the country and sharing across the world and sharing that information, it is expediting our research, correct?
Yeah, absolutely. And one thing that's really amazed me is that physicians and physician assistants, nurses, and nurse practitioners from all specialties have come together now to fight this battle against COVID-19. It's amazing, but every single person now in the medical community recognizes themselves as a COVID-19 provider, which is really great.
Yeah.
All research efforts are focused on this now. You know, previous cardiologists and neurosurgeons are now working in the ICUs and taking care of COVID-19 patients. So we have these great minds from all across the different specialties focused with one goal in mind.
Dr. Sud, thank you so much for being on. I really appreciate your insight and would love to have you back on Healthy Lifestyle when we're speaking about COVID-19 after the fact. Thank you all for joining us today on Healthy Lifestyle. My heart is lifted by sharing this time with you. I want to thank my guest again so much for coming on and sharing this great information. Remember, we're here to serve one another, so take a moment, step out of your day, and do a little something for someone else. I just want to say one thing. We recommend you consider stop listening to the news, stop going on social media unless it's for something joyful. It's toxic, it's negative, it's causing depression, and we can only handle and control what's in front of us within our control. So let's take this one day at a time, make smart choices to stay healthy and safe, wear the masks, and of course, practice social distancing. We will come out of this together. In the meantime, take a few minutes a day, maybe call or text or email or Zoom with 10 people a day. Stay connected, lift someone else up, have positive thoughts, and laughter is our best medicine. It always is. Share joy, love, and laughter. You know, like I've always said, it just takes each one of us to do something big, and we're doing that with each other today. That's what we're seeing here on Healthy Lifestyle. Thank you so much for joining us on Healthy Lifestyle. I'm Lorianne Kazdia. Until next time, please stay healthy and safe. Show love to one another by practicing social distancing. I'm Lorianne Kazdia. Show up for you and show up big.